Allergies occur when your immune system reacts to a foreign substance, such as pollen, bee venom or pet dander, or a food that doesn't cause a reaction in most people. Your immune system produces substances known as antibodies. Some common types of allergies include drug allergies, food allergies, insect allergies, latex allergy, mold allergy, pet allergy, pollen allergy. Drug allergies refer to an abnormal reaction of the immune system to a medication. When a person is allergic to a drug, their immune system mistakenly identifies the drug as harmful and produces an immune response to fight it off. This can cause a range of symptoms, from mild to severe, including hives, rash, itching, swelling, difficulty breathing, and anaphylaxis, which is a life-threatening allergic reaction. It is important to note that a drug allergy is different from a drug intolerance or side effect, which does not involve the immune system. Identifying drug allergies is important to avoid serious health consequences, and people with a history of drug allergies should inform their healthcare provider before taking any medication. Food allergies refer to an abnormal immune system response to certain foods that are normally harmless to most people. When a person with a food allergy consumes or comes into contact with the offending food, their immune system mistakenly identifies the proteins in the food as harmful and triggers an allergic reaction. The symptoms of a food allergy can vary in severity from mild to life-threatening, and can include hives, itching, swelling, vomiting, diarrhea, difficulty breathing, and anaphylaxis. Common food allergens include peanuts, tree nuts, fish, shellfish, milk, eggs, soy, and wheat. People with a history of food allergies should avoid the allergenic food and may carry medication like epinephrine auto-injector for emergency treatment in case of a severe allergic reaction. Insect allergies refer to an abnormal immune system response to the venom or saliva of certain insects, such as bees, wasps, hornets, fire ants, and ticks. When a person with an insect allergy is stung or bitten, their immune system produces an excessive and potentially life-threatening reaction, which can lead to anaphylaxis. Symptoms of an insect allergy can include swelling, redness, itching, and pain around the sting or bite site, as well as more severe symptoms like hives, difficulty breathing, rapid heartbeat, and low blood pressure. People who have experienced severe reactions to insect stings or bites should carry an epinephrine auto-injector with them at all times to be prepared for an emergency. Additionally, they may seek desensitization treatment through allergen immunotherapy, which involves gradually exposing the immune system to the allergen to reduce sensitivity over time. Latex allergy is an immune system response to proteins found in natural rubber latex, a material made from the sap of rubber trees. When a person with a latex allergy comes into contact with latex, such as through latex gloves, condoms, or medical devices, their immune system produces an allergic reaction. Symptoms of latex allergy can range from mild to severe, and can include itching, redness, swelling, hives, difficulty breathing, and anaphylaxis. People who are at higher risk of developing latex allergy include healthcare workers, people with spina bifida or other congenital disorders, and those who have undergone multiple surgeries or medical procedures. People with latex allergy should avoid contact with latex products and inform their healthcare providers about their allergy to avoid potential exposure. They may also consider wearing a medical alert bracelet or carrying an epinephrine auto-injector in case of a severe allergic reaction. Mold allergy is an immune system response to mold spores, which are tiny airborne particles released by various types of fungi that grow in damp or humid environments. When a person with a mold allergy inhales or comes into contact with mold spores, their immune system produces an allergic reaction. Symptoms of mold allergy can vary in severity and can include sneezing, runny or stuffy nose, itchy eyes, coughing, wheezing, and skin rash. People with mold allergy may experience more severe symptoms if they have asthma or other respiratory conditions. The best way to manage mold allergy is to avoid exposure to mold, which may involve reducing humidity levels in the home, fixing water leaks, and avoiding outdoor activities during peak mold season. Over-the-counter antihistamines, nasal corticosteroids, and decongestants may also help relieve symptoms. In severe cases, immunotherapy or allergy shots may be recommended to desensitize the immune system to mold allergens. Pet allergy is an immune system response to the proteins found in the skin cells, saliva, and urine of certain animals, such as cats, dogs, and rodents. When a person with a pet allergy comes into contact with these allergens, their immune system produces an allergic reaction. Symptoms of pet allergy can vary from mild to severe and can include sneezing, runny or stuffy nose, itchy or watery eyes, skin rash, coughing, wheezing, and difficulty breathing. In some cases, pet allergy can trigger asthma symptoms or anaphylaxis. People with pet allergy may be able to manage their symptoms by avoiding contact with pets or using air purifiers, HEPA filters, and regular cleaning to reduce allergen exposure. Allergy medications, such as antihistamines, nasal corticosteroids, and decongestants, can also help relieve symptoms. In severe cases, allergen immunotherapy or allergy shots may be recommended to desensitize the immune system to pet allergens. Pollen allergy, also known as hay fever or allergic rhinitis, is an immune system response to pollen, which is a fine powder released by plants as part of their reproductive cycle. When a person with pollen allergy inhales or comes into contact with pollen, their immune system produces an allergic reaction. Symptoms of pollen allergy can include sneezing, runny or stuffy nose, itchy or watery eyes, throat irritation, coughing, and fatigue. In some cases, pollen allergy can trigger asthma symptoms. Pollen counts tend to be highest during the spring and fall months, depending on the type of plant, and people with pollen allergy may experience more severe symptoms during these times. Treatment options for pollen allergy include avoiding outdoor activities during high pollen counts, wearing a mask when outside, using air purifiers or HEPA filters indoors, and taking allergy medications, such as antihistamines, nasal corticosteroids, and decongestants. In severe cases, allergen immunotherapy or allergy shots may be recommended to desensitize the immune system to pollen allergens. Symptoms of allergies can vary depending on the type of allergen and the severity of the reaction. Some common symptoms of allergies include sneezing, runny or stuffy nose, itchy or watery eyes, skin rash or hives, swelling, particularly around the face and eyes, difficulty breathing or shortness of breath, chest tightness or wheezing, nausea, vomiting or diarrhea. In the case of food allergies, headache or sinus pressure, anaphylaxis, a severe, life-threatening reaction that can include difficulty breathing, low blood pressure, rapid heartbeat, and loss of consciousness. Treatments for allergies include antihistamines. These medications can help relieve symptoms such as itching, sneezing, and runny nose by blocking the effects of histamine, a chemical released during an allergic reaction. Decongestants. These medications can help relieve congestion and reduce swelling in the nasal passages. Nasal corticosteroids. These medications can help reduce inflammation in the nasal passages and improve symptoms such as sneezing and runny nose. Allergen immunotherapy, allergy shots. This treatment involves gradually exposing the body to small amounts of an allergen over time to build up tolerance and reduce the severity of symptoms. Avoidance of allergens. This may involve avoiding certain foods or substances that trigger allergic reactions or using air filters or other measures to reduce exposure to allergens in the environment. Emergency epinephrine. This is a medication that is used in the case of anaphylaxis, a severe and potentially life-threatening allergic reaction. It is typically administered via an auto-injector.